Hello, my name is Debbie, and I want to talk to you about a disease that I was diagnosed with in September of 2011. The name of the disease is called essential thrombocythemia. You might be wondering, what is essential thrombocythemia, and how did I come to know that I had this disease? Essential thrombocythemia means that I have a very high platelet count. It is classified at Mayo Clinic as one of 4 myeloproliferative neoplasm diseases. There are 4 diseases in this category. 1, essential thrombocythemia. 2, polycythemia vera, myelofibrosis, and acute myeloid leukemia. All of these diseases are chronic leukemias. Currently, there is no cure for any of the myeloproliferative neoplasm diseases. But while there is no cure, there is ongoing research in both Switzerland, Austria, and at Mayo Clinic in Arizona. And while there is no cure, there are different drugs, chemo drugs, that are being given that help fight the symptoms of these myeloproliferative neoplasm diseases. You might be wondering, as I said before, how did I come to find out I had this disease? I went into my regular doctor's office last September for my regular yearly physical. A couple of days after the physical, my doctor called me and asked me to come back in and have my CBC run again, which is my complete blood count. He said that the platelet count was so high he thought maybe the lab had made an error somewhere. So I went in a second time and had the CBC run again, and my doctor's prior suspicions were confirmed when my platelet level did come back at being 1,234,000. The normal range of a platelet count should be between 150 and 440,000 per micromolar of blood. When my doctor called me back the second time, he said, "I don't know what the problem is, but you're critical and you need to see a hematology oncologist immediately." So I didn't have time to be afraid of what he had said, but I went about calling a oncologist that had treated me about 20 years ago for pre-ovarian cancer. I was then referred to Atlanta Cancer Care and Dr. Silpa Reddy. When I called her office and told them how high my platelet count was, they made an appointment for me in 2 days. When I went in, another CBC was run to confirm the prior 2 diagnoses. And once Dr. Reddy confirmed that, yes, my platelet count was 1.25 million, she said, "Well, we have to start the elimination process to find out what the problem is." So I was scheduled a week later to go into St. Joseph's as an outpatient to have a bone marrow biopsy and aspiration done. Well, I didn't know anybody that had ever had a bone marrow biopsy and aspiration done, so I was a little bit concerned about that. So I went online and found a live video of this procedure being done at Mayo Clinic. I really wouldn't suggest doing this if you're squeamish. But anyway, I watched it, so I knew a little bit about what to expect. That Friday, I arrived at St. Joseph's Hospital at 6 a.m. I was given a shot to relax me, and then I was given an IV intravenous drug to make me drowsy. First, I would have CT scans and lower body x-rays, and then the biopsy and aspiration would begin. Everything was going well until we were about halfway through the biopsy and aspiration when I felt an excruciating pain, and I tried very hard not to cry, but I'll be honest with you, it did hurt at this point. And the nurse explained to me that they cannot numb inside the bone where they need to harvest the bone marrow for testing. But it didn't last all that long, and pretty soon it was all over. It would be another week before Dr. Reddy's office would call me to come in and find out the findings of all the tests that were run. So when I went back in, Dr. Reddy explained to me that they had done chromosome testing, DNA testing, they had done a molecular test on all of my cells, and the diagnosis came back that I had true essential thrombocythemia. There are 2 different types of thrombocythemia, secondary and primary. The case that I have is primary. for a couple of reasons. I did test positive for having a mutated JAK2 gene. Also, I did not have an underlying cause that would be causing my platelet to be high, such as having a splenectomy, recent surgery, or blood loss, or anemia. So my case is that I did have essential thrombocythemia. I asked Dr. Reddy what would the treatment be and what was my long-term prognosis. She told me that the disease was chronic, meaning that it is incurable, and that for the time being she wanted to put me on 81 milligrams of baby aspirin, and that I would be seeing her once a month for the rest of my life. However, she did want to send me to another specialist and have a cardiovascular workup, an upper body GI series, and another colonoscopy done to rule out internal bleeding and heart problems. So I made an appointment and I had all these tests done and they all came back negative. My colonoscopy was good, my upper GI series didn't show anything, and all of the x-rays, chest x-rays showed no, and lower body x-rays showed no internal bleeding. So that was a good thing. So Dr. Reddy said that there were a couple of chemo drugs on the market, one called Agrelin, another one called hydroxyurea. She told me that hydroxyurea was the most effective fighting against a blood and bone marrow disease for killing off platelets, but that because the side effects for the hydroxyurea were, in her opinion, more severe than the disease. So we went about several months, 7 months as a matter of fact, of just taking the baby aspirin and watching my platelet count, my red and white blood count as well. On the 7th month that I went in for the CBC, my blood platelet count was still 1.25 million, and Dr. Reddy said that she had no choice but to put me on the hydroxyurea, but she was going to start me on a 500 milligram daily capsule, which is a low dosage, and see how my body adjusted and see if that would start bringing the platelets down. I stayed on hydroxyurea 500 milligrams a day for 4 months. My platelet count did not come below 1 million, but one time, and that was 997, so that was barely anything at all. So as of 3 weeks ago, Dr. Reddy has put me on 1,000 milligrams of hydroxyurea one day, 500 milligrams of hydroxyurea the next day, and I will have to see her again in 2-week intervals. When you're on a drug such as hydroxyurea, and this is considered a chemo drug, you have to have blood tests done regularly, and that is so that you can keep a good check on the platelet level, but also on the red and white blood cell counts, because hydroxyurea chemo drugs do not know the difference between the abnormal cells that my bone marrow is now mass producing, and it does not know the difference between the white and the red blood cells. So in other words, you have to keep a check on all this, and it's a teetering act to make sure that one doesn't drop too low, one doesn't go too high, but that my body stays in balance as much as possible. I know this has been sort of a roller coaster ride, but I will say that I have done very well on the hydroxyurea. I have had a few days where I've been nauseated, sick on my stomach, but those are rare and far in between. I think all in all, my body has adjusted very well. I haven't had any side effects from the hydroxyurea, except I am suffering from shortness of breath, and I am severely fatigued. So that is both partly responsible of the disease itself and from the hydroxyurea. Now, in some cases, long-term, because essential thrombocythemia is a slow progressive disease, a person could live from anywhere from 3 to 10 years without any complications or side effects from either the disease or from the drug. Now, hydroxyurea has a high prognosis of developing of my disease or any of the other myeloproliferative diseases developing into acute myeloid leukemia. So that's another reason that this platelet count and my CBC has to be run on a regular basis so that all these blood counts are taken into consideration to make sure that there aren't any fast changes made so that the dosage of my medication will have to be changed or the medication itself changed to another drug. So right now I'm doing fairly well on the hydroxyurea, and I will be seeing my cardiologist next week. Dr. Reddy wants me to have a workup on my heart done to rule out any type of onset of heart disease or anything wrong with my lungs that would be causing me to have the shortness of breath. I hope you've enjoyed this video and that you've become a little bit more aware and familiar with rare and incurable myeloproliferative neoplasm diseases, and I will be making another video in a couple of months so that you can keep abreast of any of the treatments and side effects or my prognosis as a whole. So I hope that you share this video with your friends or anyone suffering with a rare and incurable disease, and I invite you to visit my Facebook page called Living with Primary Essential Thrombocythemia for daily updates. Thank you so much, and happy health.